Welcome everyone to the Strong Hips for a Strong Pelvic Floor class. My name is Lisa Gillespie. I will be your guide for today. I am a nutritious movement certified restorative exercise specialist. That's quite a mouthful. What I do is help people learn how to move better so that they can feel better and reduce various symptoms, whether that's various joint aches and pains, or like today, we're coming together for the purpose of pelvic floor benefits. Today, we're going to be doing a lot of movement, and our new movement is going to be focused on the muscles around the pelvis, specifically the lateral hip muscles, which for most of us are pretty weak, and we'll talk a little bit about why that's the case. But the bulk of our time is going to be spent doing exercises and some stretches to work with those muscles. And the benefit of doing that is we're going to help stabilize those muscles as well. And as we strengthen them, we get pelvic stability, and that benefits the pelvic floor as well. Obviously, there are a lot of pieces to the pelvic floor puzzle, and this is one of them that we'll be working with today. Let's see, what else do I want to let you know? We're going to be doing some progressive buildup of the exercises. So we're going to start off with a more basic version, and we're going to be adding what I call different layers to the work. So we're going to have the basic exercise, and then we're going to fine tune it and dial it in a little bit. At any point, you get to say, I'm not able to fine tune this any further, or I'm going to stick with the level that I'm at and not do the more difficult version. And I really strongly encourage you to respect where your body is right now and to not feel like you have to muscle through it or prove something to yourself by doing everything all at once. That's one of the great downfalls I see of people getting into the alignment work, is the natural tendency to want to do everything all at once. And I really encourage you to work more incrementally and progress more gradually, because over the long run, that's going to benefit you a lot more than trying to cram everything in and doing too much for your body or short-circuiting your brain in the process. Please know, excuse me, I do not know you or your body, so you are aware of your history, whether that is certain injuries, surgeries, or specific conditions that you have going on at this time. So please modify exercises accordingly, and if you need help, feel free to type into the chat box, and I will do my best to do that. We're going to have start with a little bit of anatomy. I'm just going to show you 3 short slides so that you have a visual of what we're going to be working with today. I am an anatomy geek, and I think it's really fascinating to learn more about our bodies and to better understand what specifically we are working with and the structures that are underneath our skin. So I'm going to show you a brief anatomy intro, then we're going to jump right into the exercises, and we'll have about 50 minutes of exercises. And then I'm going to wrap that up by showing you a short preview of my upcoming Freedom from Kegels course that registration is opening today, and give you a little sneak peek, because I know there are some people interested in that course. It'll help you see whether or not that's a good fit for you. And then after that, it'll be about 5 minutes. I'm going to take questions, so if you have questions about what we've covered today or burning questions about alignment and movement, I am glad to stay afterwards and answer those questions for you. So let's get started with a little bit of anatomy here. Like I said, we're just looking at 3 short slides. Not that one. There we go. All right, so here we are. We're looking at the back of the pelvis. So we have the left and right sides of the pelvis that you're looking at, and then the thigh bones extending down from that, and the spine extending up. And on the left side, you're looking at the left gluteus maximus, which attaches to the sacrum, that triangle bone in between the left and right halves of the pelvis. And then if we peel the way the gluteus maximus muscle you would see on the right is the gluteus medius muscle. And this is part of our, what we call our lateral hip muscle group. The gluteus medius is one of the muscles that make up that group. And it's involved with helping to stabilize the pelvis. So is the gluteus maximus muscle. And then you can see a little bit, this is a side view. So we've slightly turned the pelvis, it's at an angle. And you can see how the gluteus medius attaches to the top of your pelvis, and then it attaches to the top of your thigh bone. And if you were to feel down the side of your hip, you would bump into this bony knob, which is the top of your thigh bone or the top of your femur, also known as the head of your femur. And then another muscle in this lateral hip group is the tensor fascia lata muscle. And that muscle is on the upper side of the pelvis. So here we are looking at a front view of the pelvis, kind of a front angled view. The tensor fascia lata muscle runs into the iliotibial band, which is that band that you see running all the way down the side of the leg and attaching just at the top outside of the lower leg. So we're going to be working with the gluteus medius, the gluteus maximus, as well as the tensor fascia lata muscle. So that's what we have on our agenda for today. All right, I'm gonna do my best to keep track of the chat box, and I'll break occasionally here and there to check in with it. If you have a hip replacement, or if you have pubic symphysis dysfunction, pain in your pubic symphysis bone, or where that joint is, I should say, I'm going to point out some modifications, and I'm going to point out some things that you should not be doing if you have anything going on with the pubic symphysis or if you have a hip replacement going on. So we're going to get started with something called the monster walk. The monster walk has a lot of different layers to it. At its most basic layer, it's simply walking sideways. So you're going to start with your feet. Your ankles are going to match the width of your pelvis. And then we're going to step out about 6 inches. And then we're going to step back in, bringing the feet back into pelvis width. And we're going to continue to travel sideways with this type of walk. So we're doing a sideways walk. And as you walk sideways, I want you to keep track of the outside edges of your feet. And as you reach the end of your path, go ahead and move the other way. So as you're checking in with the outside edges of your feet, I want you to notice whether or not they're turned out or if they're straight. And if they're turned out slightly, I want you to work to bring the outside edge to a more straight position. When we turn the feet out, we tend to bypass using these lateral hip muscles. And so we're really wanting to emphasize using those muscles, which requires the outside edges of our feet to be straight. So we're just doing a nice, steady pace. We're not rushing through this. Just nice and methodical. And you should be feeling some activity, some work happening along the outside edges and the back portion of your hips. And I'm going to have you pay attention to one other thing as you do this. Watch that your knees are staying straight. So we don't want the knees to bend with either stepping out or stepping in. We want to keep the knees nice and straight. And we'll do one last pass to finish it up. So we've got outside edges of the feet straight, and we've got knees straight, not bent. right, I'm just gonna check in with the chat, see if there's any questions. All right, very good. And then from here, we're gonna do a little bit of a stretch for those muscles. You're gonna have a chair, and in your seated position, you're gonna cross your ankle over your knee. And I'll face you so you can see what that looks like from the front. So we've got the knee and the pelvis in line with each other on our non-stretching leg. And then we've got the ankle over the thigh, just above the knee with the other leg. And you may notice that this is plenty of a stretch for you through this area. And if so, that's great, just hang out here. I want you to check that you're not rounding your lower back and tucking your pelvis, but that you're sitting up on the base of your pelvis and maintaining the curve in your lower back. If you're really tight here, and that is really difficult to do to overcome the rounding in the low back, then what I encourage you to do is grab a bolster or something to sit up on, a book, and we'll switch sides here, so that you elevate your pelvis, and that will help you untuck, and that will also decrease the stretch a little bit so that it's more comfortable and that you're meeting yourself where you are a little more effectively. So this is what we call a number 4 stretch, and there are a few different varieties or versions of the number 4 stretch. This is the chair version. We'll do a standing version momentarily. All right, and then we'll come back to standing. And grab a book or yoga block. I'm gonna have you place it on the floor longwise, so it's running front to back. And then you're gonna place one foot on the yoga block. Check that the outside edge of that foot is relatively straight. And then you've still got like a kickstand of your other foot on the floor. And then I want you to check that your pelvis, and I'm going to turn sideways so you can see me a little bit better. I want you to check that your pelvis is back over your ankle rather than drifted forward. So we want to back the pelvis up so that it's stacked over the ankle, and we've got the outside edge of the foot fairly straight. Then from there, I want you to slowly remove your kickstand of your other foot so that you're balancing on just one foot. And if you're really wobbly, if this is too much, by all means, hold on to the wall, hold on to the chair, do what you need to do to help yourself feel safe. And what you should be noticing are that these muscles along the sides of your pelvis, or your standing leg side of your pelvis, is really working. You may notice you're a little wobbly. And then we'll come down and we'll switch sides. You get to discover which side is your weaker side. We tend to be inherently asymmetrical due to our movement habits throughout the day and just maybe a variety of things that have happened along our journey that have contributed to different asymmetries. So on this second side, again, we're checking in the outside edge of the foot is straight. And we're also checking that the pelvis is stacked over the ankle rather than drifted forward over the front of the foot. Once you feel like you're situated with those two parameters, go ahead and gently release the kickstand of your foot and just hang out here on this standing leg. You might want to feel as if you're pushing your block away and pushing down through your standing hip. And just notice, what is it like on this second side for you? And then we'll come back and we'll revisit the first side again. So we've got straight outside edge of the foot. We've got pelvis backed up over the ankle. And then when you're ready, you can release your support foot, your kickstand, and you're pushing down through the heel of your standing leg, down through that side of the pelvis. For those of you that want to add another piece on, you can check in and see what's happening with your torso. And are your ribs up? And if so, can you relax the front of your rib cage down? And as you relax the front of your rib cage down, you will feel slumpy, I promise. But as you relax the front of your rib cage down, your core muscles are in a better position to engage and offer you support. And we'll switch to the other side. And remember, the ribs piece, that's optional. So if you've got plenty to juggle with straight outside edge of the foot and pelvis backed up over your ankle and not falling on your face, then just stay with that. So we're situated here, and then we release the kickstand foot. And just notice, what's it like to push down through your standing leg, down through that side of your pelvis. And if you would like, can you relax your ribs? Relax the front of your ribs down. And notice what it's like on this second side compared to your first side. Are you holding tension anywhere that you really don't need to? Oftentimes the arms, the shoulders, the jaw will all try to help out. All right, coming out of that. We're going to come into another version of the number 4, but this time we're going to use the back of the chair. Or if you really like the seated version, by all means, go back and do that. For this version, we're going to cross, I'll face you, we're going to cross the ankle over the upper thigh, or over the thigh just above the knee. And then we're going to sit back. And as we sit back, we're going to do our best to keep the knee stacked over the ankle rather than allowing the knee to drift forward over the front of the foot. So we're backing it up. We're maintaining the curve in the lower back rather than rounding under or tucking the pelvis under. So it's probably going to feel like you're sticking your butt out. And the lower you go, the more stretch you will have. And we'll switch sides. So crossing the ankle just above the knee and then sitting back. Lowering down into the stretch. So we're stretching the one side, at the same time we're asking the other side to do a fair bit of work to help support us. And again, can you let go of your jaw? Can you let go of your shoulders? And just allow the muscles that need to work to do the work. All right, we're now gonna come down to, actually before we go down to the floor, we're gonna do monster rock again. Now we're gonna go down to the floor. So we're gonna start checking in outside edges of the feet, having the ankles pelvis width. And if you would like to, you can also add in rib cage alignment here. So we're checking that the front of the ribs are relaxed down versus chest up. And when we relax the ribs down, we help align the abdominal muscles, the attachment points of those abdominal muscles, so that they can work more effectively. And we are walking sideways, maintaining the straight outside edges of the feet. We're also keeping the knees straight. And we're shifting our weight from one leg to the other. So it's a straight-legged, side-to-side walk. Feels somewhat awkward. And on this next pass, I want you to think about landing your foot heel toe if you haven't already been doing that. And we're going to continue. So outside edges of the feet straight, knees straight, and landing heel toe. All right, you can continue, do another pass. I'm going to check here with the chat. All right, so someone's feeling more tension in the outer lower leg. I would say that certainly falls under the realm of normal. You may be noticing those muscles may be working harder to help stabilize you to make up for lack of strength in the outside, the lateral hips. All right, another question is my hyperkyphosis causes me to lean forward to stack my hip over my ankle. Yep. It's difficult to know if this exercise is effective while bending forward. So yeah, you certainly can still work the lateral hip muscles, even if you're having to have more of a curve in your upper back as you're doing it. These muscles are still needing to work. And somebody's, oh, while you were on the block with one foot. Okay, thanks for clarifying. So yes, that would still, those muscles still have to work, the lateral hip muscles still have to work to stabilize, even with the hyperkyphosis causing you to lean forward. The trick is, if you're working with your hyperkyphosis and aligning the rib cage, you're also going to watch the tendency for the pelvis to come forward. So the trick is going to be keeping the pelvis backed up while the rib cage is aligned. And it will still continue to progress. Quads turn on as the upper body softens. Yep, quads are so helpful, or they try to be so helpful. All right, we're going down to the floor. Now, if you have a wall in front of you, this is what I'm wanting. If you don't have a wall in front of you, then when you do, this is what you'll do. And you can still, I'm gonna face this way so you can see me better. So what we're doing, if you don't have a wall in front of you, like I don't, you can imagine you've got a wall in front of you, but this really needs a wall in front of you, ideally. So what we're gonna be doing is pushing into your right foot. So if you have the wall in front of you, you're pushing into the wall with your right foot. And if you have the wall in front of you, the soles of your feet are up against the wall. Now, if you have a lot of hamstring tension and it's difficult for you to sit on the floor with straight legs, and/or it's difficult for you to not tuck your pelvis when you're sitting on the floor with straight legs, then what you can do is bolster yourself so that you are uplifting the pelvis a little bit higher, which will help decrease the amount that we're asking the hamstrings to stretch to accommodate this position. So once you're situated, you've got the wall in front of your feet, making contact with the soles of your feet. You're pushing into the wall with your right foot. And as you push into the wall with your right foot, the lateral hip muscles will engage on the right hip. And then we'll release, and you'll push into the left sole of the foot. So you're pushing the wall away with your left foot. And we're coming back to pushing the wall away with the right foot. And just feel, what is it like to have those muscles engaged? Because we're going to take this to a standing position, but sometimes it can be easier to feel when you're seated, just to start to get what action we're wanting to occur. And we'll push into that left foot now. And pushing into the right. If you don't have a wall and you're doing this with an air wall, you're not going to feel those muscles engage because they require resistance in order for them to kick on. And we'll switch back to the left. All right, then we're going to come to a standing position. So we used the block previously. Yeah, the inner thigh, so there's a question about the inner thigh working as you're pushing the leg against the wall. And yes, that's fine, that will happen. It's not, none of these exercises are gonna be solely using one specific muscle. As much as we're trying to hone in on a group of muscles, there will inevitably be other muscles that are participating, and that's fine. Now what you might find is, as someone mentioned with the tension on the lower leg, noticing that, you might find that because of weakness in this area, the lateral hips, other muscles are helping out, whether that's the quads gripping to help stabilize, or that's muscles in the lower leg having to work a little extra hard. And as these muscles get stronger, other accessory muscles that have been trying to help pick up the slack don't have to do that, so the workload gets evened out. I'm not saying that's why your inner thigh muscles are working, but you might notice a little less inner thigh work, although I would expect your inner thighs to be working to some degree. All right, so now we're in the standing position. So this is just as if the wall is now the floor, okay? So I want you to just start very simply with shifting your weight to your right leg. So you're supporting most of your weight on your right leg. Your left foot is still in contact with the floor. And then we're gonna push the floor away and shift our weight over to the left leg. And then notice what it's like to support most of your weight on your left leg. And again, check that the pelvis hasn't drifted forward. So we're wanting to keep the pelvis stacked over the ankles as we do this. And then we're gonna push the floor away with the left foot and shift back to the right leg. So we're now supporting primarily on the right leg. For those of you that wanna add a couple other pieces in, I just want you to check in with your ribs. Are you thrusting your ribs and lifting the chest up? And if so, can you relax that down and allow the rib cage to be stacked over your pelvis? And we'll push that away, pushing the floor away, and shift to the left leg. So we're preparing to support all of our weight on our one leg, and we're going to be doing that next. So now we're going to shift back to our right leg. This time, as you push the floor away with your right foot and you're pushing your right hip down, see if you can teeter-totter your pelvis so that as the right side of your pelvis is going down, the left side of your pelvis floats up. And you are able to lift or lose contact between the sole of your left foot and the floor. And then we'll come back to both feet and we'll shift weight to our left leg, checking in that the pelvis is back over the heel. And then we're pushing that floor away on our left, with our left foot. And as we do that, we're teeter-tottering the pelvis. The left side goes down and the right side floats up. And here we are, standing on one leg. If this is a lot for you to do, use the wall, use the chair. There is no harm done by helping yourself out. And if losing contact with the foot is too much for you at this point in time, continue to just play with the weight shift. That is a valid and helpful precursor to this. You will still be working to develop the strength in the lateral hip muscles. And we'll come down to both feet and we'll switch again to this first side, pushing the floor away. This time we're gonna gently lower the left foot down just so it's hovering over the floor. We're not putting our weight all the way on it. And then we're gonna push down on the right hip to lift it up. And then we're gonna let it float down towards the floor and push down through the right hip to float it off and lower it down. So I'm just lowering, I'm playing with the teeter-totter here. Pushing down on that right side to float it off on the left. Lowering it down. We'll do 2 more here. And lower it down. And one last one. And we'll come back to both feet. We'll switch over to the left side. And we'll push down through that left foot, pushing the floor away, pushing the left side of the pelvis down, and floating the right foot back down towards the floor to then push down with the left side and lower the right. And push down with the left. Notice I'm saying pushing down with the left versus lifting the right up. And we're lowering the right down. I don't want you to be doing this movement by hiking your right hip up. I want it to be about the muscles on the left side contracting to pull the left side of the pelvis down, and then what happens is the right side goes up. We'll do one last one. Bringing it left side down, right side up, and we'll come back to both feet. Whew, you might be feeling the burn at this point. We're gonna come down to the floor. I'm just gonna check in with questions. All right, so one question, and I'm sure that she is not alone in this question. The question is, there's a lot of, or the noticing is that there's a lot of tilting of the torso over to one side as in this exercise. And that is really common. As we develop more strength in these muscles, there will be less tilt of the torso required. So the tilt of the torso is one way we help leverage the opposite side off of the floor. And it's also partly a balance issue as well. So as things get stronger and more stable, there will be much less tilt of the torso required. In the meantime, you're doing the best you can. So just know that that will change and evolve as you get stronger. All right, somebody just noticed that their weaker hip is the hip that their doctor wants to replace. So interesting. All right, we're going to lie down on the floor. Now you may notice I have a bolster and a half dome here. This is a half dome if you're not familiar with this piece of equipment. It's foam roller sliced in half, and then it's about 12 inches. So I'm placing this under my head, and I'm using the bolster to prop up my upper back so that my ribs can be relaxed down in the front versus thrusting up. You can use a pillow or a blanket. Pillow is sometimes a little bit too cushy, so a folded up blanket works well, or a large bath towel. We're gonna have the knees bent. And I'm gonna say you may want to have a block handy or a book. We're gonna cross the ankle over the upper thigh, so just above the knee. And we're going to, keeping the ribs relaxed down, we're going to twist the pelvis. So let me get situated here. I have my right leg crossed over my left thigh, and I am rolling towards my left, and I'm bringing my right foot down to meet the floor or to meet the block. So if going all the way down to the floor is a little too much stretch for you, you can decrease the amount of stretch by placing a block under the sole of your foot. Or I worked with somebody today who needed a block and a book, and we turned the block sideways to make it higher. So just know that you'll feel some stretch along the outside of your thigh and the outside of your leg, but this should not be a stretch that you have to peel yourself off the ceiling for, okay? So if you need to back it off, please do so. Please do not grind it out thinking that no pain, no gain. But respect where your body is. And if you need a block or a book under the sole of your foot for now, so be it. And once you're situated, see if you can allow the back of your ribs, the right side of your ribs, to relax down towards the floor. So we've got the pelvis twisting towards the left, and ideally the ribs are still facing the ceiling versus being twisted to the left. So we want to minimize as best we can how much the torso rotates along with the pelvis. If you have diastasis recti, you may be concerned about doing twists, and that's understandable. There's a lot of information out there about never twist if you have diastasis recti. That decision is certainly up to you and what you feel comfortable with doing. So that's number one. Number two, if you are deciding you want to experiment with doing a twist, the way to keep it safe with diastasis recti is to make sure that the ribs are aligned with the pelvis so that you're bolstered versus allowing the ribs to stick up and out. So we don't want a rib thrust. We want to make sure the ribs are relaxed down. All right, so we're gonna roll out of this. You can do this two ways. You can just straighten your legs and come out, or if you want to do a little bit of core work in the process, you can engage your core or allow your core to engage. You don't have to actually do it. It will reflexively happen. And roll out of this nice and easy. And then we'll switch sides. I'm going to actually turn so that I don't run into my wall. So we're going to now have the left ankle crossed over the right thigh, and you're going to be rolling towards your right. Bring your left foot to the floor. So your pelvis is twisting to your right. Your left foot's in contact with the floor. And ideally, the left side of the back of your rib cage is staying in contact with the floor. And if it's not, does that mean you have to force it to do that? No, it does not mean that. It just means, oh look, I got a little extra tension there and I can't quite yet keep the left back part of my ribs on the floor. You're just making a note of it. There's nothing wrong, there's nothing bad about it. It's just, this is where your body is right now at this point in time. And we get to breathe. And you might want to check in that the ribs are relaxed down. Sometimes a little tension can sneak into the back and the ribs will pop up. And check in with your jaw. I don't know about your jaw, but my jaw loves to help out all the time. All right, and then again, you can come out of this by straightening your legs or by rolling out and allowing the abs to kick in to bring you out of this position. All right, we are now going to come back up to standing. We're going to revisit our monster walk one more time. All right, there was a question about stretching. Yeah, so the bottom knee may not go flat on the ground, Liz. And you can put a block or a bolster underneath it to support it, so that part of it not going onto the ground just has to do with some tension through the hips. I mean, it could also have to do with your growing baby, but more likely it's tension through the hips. So do as you can. And what's being stretched in that are these muscles on the side of the leg wrapping around through the glutes. And yes, the glutes also love to help out. All right, I went too high with my screen. Sorry about that. So we're going to come back to our monster walk. And monster walk, so just go ahead and start traveling side to side. As you do it this time, think about the heel of your stepping foot leading the way. So we got the heel, and by leading the way, I mean as if you were turning your thigh in, but not quite. We're not doing that. We're just really emphasizing the straight outside edge of the foot. And the same with the following, the stepping in part. Because sometimes we get these interesting little cheats that happen where the second foot will just turn out ever so slightly to bypass the use of those muscles. So we've got straight outside edge of the foot. Now I'm going to turn sideways. Check that your pelvis hasn't gone forward, but that you're staying back as you do this. So we've got straight outside edges of the feet. We've got pelvis staying back over the ankles. We've got ribs relaxed down. And I'm gonna offer you another thing to check in with, but it's entirely optional. If your brain is full with what you're already doing, ignore what I'm saying, okay? However, if you want one more thing to check in with, notice what your pelvis is doing, and notice in particular, is your pelvis twisting as you are stepping? So if you had headlights on the front of your pelvis, would your headlights, the light of your headlights, continue to shine straight forward? Or would they be sweeping across the landscape? Ideally, we've got a nice straight beam coming out of the left and right sides of our pelvis in our imaginary world. Another great way to check this is by doing this up against a wall, so that the left and right sides of your glutes are in contact with the wall, and you can get a tactile cue as you monster walk. Do you lose contact with your glutes as you step? and you might notice it's only one side that loses contact, or you might notice it's both sides depending on which step you're taking. So that's a fun way to check in with the pelvic twist. But I also want to reiterate, if you have enough to keep track of with straight outside edges of the feet, straight knees, and landing heel toe, then by all means, stick with that. Develop some strength here, and then you can dial it in and fine tune it a little more over days and weeks, okay? There's no sense in pushing yourself to do everything all at once. I know I sound like a broken record with that, but I can't tell you how often I see that being really, really problematic for people. We get so excited and enthusiastic about doing something that's going to help us to feel better, which is awesome, but then we try to do all the things all at once, and we get frustrated, we get overwhelmed, our brain can't manage it all, and then we throw in the towel. So just remember, it is never all or nothing. Every little bit helps, and it's a process. All right, I think I got some questions, so let's see. So the stretch, okay, Liz, going back to the hip twist, the stretch for most people is more in the leg that is where the foot is on the floor, that twisting. Although for some people, I mean, each person is different. So if you're feeling it more in the leg that's closer to the floor, that's not wrong. It's just what's happening for you right now. All right, we're now going to come to back to the block. This is where, if you have a hip replacement and or you know that you've got pretty significant osteoporosis in the head of your femur, or you have pubic symphysis issues, I want you to not do this exercise and instead stay with the floor version that we did, where we were floating the foot off the floor and lowering it down and floating it up and lowering it down. If your pelvis is pretty good and you don't have a hip replacement or significant osteoporosis or pubic symphysis issues, then we're going to do that floating, lowering it down, floating up, but we're going to do it on the block. So we get a little more room to lower it down, the floating foot down. So we've got on the block, we have our kickstand foot helping us out here for a moment as we get situated. We've got the outside edge of our standing foot straight, and pelvis is stacked over our ankle. And then we're gonna push down through our standing leg to float the opposite foot off. And then we're gonna lower that foot down towards the floor. You're not gonna reach the floor, that's fine. And then you're gonna push down through that left foot to float the right side up and lower it down. Now, we have been doing a lot of work today so far. And my lateral hip muscles are certainly a little bit maxed out at this point, especially my left side, which is my side that is a little more challenged. So you might notice you're pretty wobbly here. So just do what you can. See if you can do 2 more of this, floating down and floating back up. Oh! Keep the ribs relaxed down so your core can also help out. Last one, up, 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 and we'll switch sides. So we've got straight outside edge of the foot. Both knees are straight. Pelvis is stacked over the ankle. And when you're ready, you can release your kickstand. And then we will float that left foot down towards the floor and then push down through that right foot and the right side of the pelvis to float it back up. And lowering it down and back up. So one of the things I occasionally catch myself doing, especially as I'm pushing up, is my floating knee will bend because I feel like I'm getting my foot higher, but I'm really not, I'm just cheating. So in case you notice that happening, you're in good company. And we'll do 2 more here. It really is incredible the difference between my right and my left. And last one here, pushing down, 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 down. Whoop. And there we go. All right, we'll come back to the floor. I would, with arthritis in the hip, sorry I didn't see that sooner, I would stick with doing it on the floor and not yet do it with the block. As you develop more strength, then you might be able to progress to the block, but do it really gradually and see what you're noticing with your body. All right, we're gonna come back and do the hip twist. So Liz, I'll try to point some things out as we do this. Let me check my screen. All right, so I'm bolstered. My upper back is bolstered. I've got the bolster right about shoulder blade level. Sorry, I didn't mention that earlier. And then I've got something to support the back of my head so I'm not hyperextending my neck. And I'm gonna cross my right ankle over my left thigh, just above the knee. And then I'm gonna rotate my pelvis to my left, bringing my right foot down towards the floor or the block. And if you're feeling a lot happening in the leg that's on the floor, go ahead and put something underneath that knee to decrease the amount of twist. See if that helps. And see if that helps as you can relax a little bit more into it. If you notice a little more stretch, Liz, through that right outside of the hip, outside of the leg. And check in with your breath. And just see, are there any areas that are holding tension that would like to let that go, even just a little bit? And then we'll come out of this, straightening the legs or rolling out. And I'm gonna switch my bolster to switch sides. And then you're gonna cross your left ankle over your right thigh. And rotate towards your right. And notice what it's like to allow the ribs to relax down. And to allow the back of the left side of your rib cage to relax down towards the floor. Nice breath. And then we'll come out of this, straightening the legs or rolling out. gonna stay here on the floor, and I'm actually gonna bolster myself a little less here and just have something under my head. So you're gonna have the heels underneath your knees. Just checking I'm in a good view here. So I've got my heels stacked under my knees, and I'm going to also check in that the outside edges of my feet are straight. Then I'm going to tuck my pelvis under and push down through the soles of my feet to slowly lift my pelvis up just a smidge. So I've lost contact with the floor, but I'm not as high up as I could if I were doing a bridge. So I'm just kind of hovering my pelvis over the floor. And in this hovering position, I'm going to shift so that I'm pushing down more with my right foot, and my left foot is not doing as much work to support me. So my right foot and leg are doing most of the support work. And then I'm going to come back to both left and right legs supporting me, and I'm going to shift over to my left. So it's as if I were going to lift my left foot off the floor, but I'm not doing that. I'm just doing a weight shift, kind of like what we did earlier when we were doing the weight shift side to side. And we'll come back to the right foot, pushing down. So I'm just engaging hamstrings, some glutes, and lateral hip muscles. And shifting to the left. Check that the ribs aren't popping up, but that they're staying relaxed down. Core will also be engaging, and we'll shift back to the right. And we'll shift back to the left. Just see how little weight can you have on that right foot and have the left foot supporting you, or the left leg supporting you. And we'll come back to both, and we'll roll down. All right, and if you want, we're not going to today because we're reaching the end of our time together, but if you wanted to progress with this, you could come back up to that pelvis hover position, and you could shift your weight to one leg and float the other leg off the floor, or the other foot off the floor, so that you're stepping. All right, but that takes a lot of strength, and if you don't have it yet, that's fine. Stay with the weight shift and just work from there. All right, I'm going to check in with questions. Do you have experience helping people with rotated pelvis? So a lot of people have a rotated pelvis. That's a fairly common thing, and it's often related to our daily habits and how we're moving throughout our day, and even something as simple as how we're standing. I had one client that, you're welcome, Pamela, thank you. I had one client who had a habit of standing with her ankles crossed in this position, and as you can see, that has a rotation component to that. Also, our driving position can sometimes reinforce a twisted pelvis. So there are a lot of different pieces to that twisted pelvis equation, but mobilizing areas that have tension or greater limited mobility and strengthening other areas can help to stabilize the pelvis in a more symmetrical position. All right, so another question is, if I've never done Kegels and now leak a little bit, should I start with Kegels? So that's a great question. I want to go on record saying that I am not anti-Kegel. I think there certainly is a time and a place for Kegels. However, my concern is that a lot of people are just doing Kegels and they may or may not be doing Kegels correctly. So there's that piece of it. Sometimes when people are doing Kegels, what they think is contracting the pelvic floor, they're actually bearing down on their pelvic floor, which is not what you want to be doing and can actually be contributing to the problem you're trying to correct in the first place. The other thing that we have to keep in mind is that there are a lot of pieces to the pelvic floor function equation, and Kegels are like a drop in the bucket, shall we say. And so I take a broader view to pelvic floor function than just Kegels, and looking at what are the movement habits that we have, what are the strength deficits that we have, what are the mobility deficits that we have that are all interfering with the ability of the pelvic floor to function well. And what I find is that when people start doing even something as simple as the exercises that we did in today's class and start paying attention to if they're thrusting their pelvis forward and if they're clenching their glutes all of the time, making some simple changes like that can have a dramatic benefit with leaking and incontinence. There may be other pieces that are needed for that. Walking is another really important thing, and walking in a way where you're able to utilize your glutes. And I won't go into that, but just the brief version is that utilizing your glutes is going to help stabilize your sacrum, which is the bone that sits between the left and right halves of your pelvis. And when the sacrum is stabilized, it helps to anchor the pelvic floor muscles that attach to the inside of it. And that helps to improve pelvic floor function for some people. So there's a few different pieces to the equation, but I'm a big fan of looking at how you move and helping to bridge the strength and mobility deficits before jumping right into doing Kegels. All right. Well, thank you so much, everyone, for joining in. It was great to have you here. And I'll be sending out the recording, so if you had to miss part of it or you want to revisit it and practice along again, you are welcome to do so. And I look forward to seeing you all next time. Have a great rest of your weekend.